Myself, I am Dr. Manjiri Somashekhar. I am the lead pediatric surgeon at Aster Hospitals, Bangalore. Pediatric surgery is a branch which deals with the smaller children up to the age of 18 years right from the birth. We deal with all kinds of defects which are detected or not detected before birth, which are tackled after the birth, and also new symptoms which are appearing during the entire childhood. We do look into them, and if any surgical intervention is required, we are the people who help you out to heal your children. Today I would like to talk about some common symptoms which are not taken very seriously by parents, like stomach ache and some common urinary problems. Now, stomach ache is very common in children. It's a common symptom, and there are various reasons why the stomach ache arises. In a smaller baby who is a toddler or who is still in mother's lap, they'll be crying unnecessarily, intermittently, or continuously, and the new mom will not be aware of it. What's the reason for that? So there are certain signs which you need to be very, very notifying, and you should know why it is happening to my baby. The older children may be able to localize or point out to the exact point where the pain is started in his tummy. So commonest causes in very small babies who are breastfed or bottle fed is a gaseous bloating that is due to the abnormal or not correct techniques followed during the feeding time. So these babies, they swallow a lot of air, which causes a bloating symptom and which causes distension and discomfort in the babies. Other important causes are the infections, which can happen due to handling of the children, or in older children due to their unregulated eating habits. Nowadays we see a lot of junk food being circulated among these children, and the want for it more and more, which brings infection to their intestines. So we need to be very careful about it. I would like to point the new parents what are the symptoms you should really give attention to, and when you should go to a pediatrician or a pediatric surgeon. Like continuous stomach pain off and on going on for 2-3 months, which can be associated with constipation. Constipation doesn't mean not passing motion. Your child is struggling to pass motion even once a day, and it's very hard or it is painful. That is the definition of constipation. So please give attention to that symptom. On the other hand, any acute infection causing loose motions, which may or may not be associated with blood or pus in the motion, they're not able to pass motion at all for few days together, then associated fever, vomiting, any pain in passing urine, all these things we need to be very careful about them, and instead of trying to give some home remedies, seek the attention of a pediatrician or a pediatric surgeon immediately. The alarming symptoms like vomiting of green color bile or blood in the vomitus, or acute pain which causes a child to roll on the floor or make it blue and black and cry excessively, they are the emergency situations wherein the child might have got an acute infection in the appendix or the pancreatitis, or sometimes a hole in the stomach or intestine following some infection, and some bleeding which can be because of the abnormal blood vessels which have suddenly burst open due to high pressure in the intestines. These are very, very critical situations, and you need to take the child to pediatric emergency room. So this is all about the common things one should know about the stomach ache in your child.